Hello everyone, nice to meet you again. And today I just want to talk about a very important topic that someone has sent me a message asking to be clarified. So this individual doctor has found that he's having a feeling that the clinical team which he belongs to doesn't seem to value his work and his contributions, during the ward round and afterwards. So he doesn't feel like his work is valued. He doesn't feel like he's well trusted. So, and he sent me this request, and I just wanted to walk through a few things to consider that's going to help anybody, that is involved in one way, shape, or form in an NHS ward round. Oftentimes, these are led by consultants. So, but this video will be applicable to anyone or any form of ward round. So, a few things to understand. Ward round, at least in an NHS setting, would start with some sort of handover where you have the take team, which is another term for the on-call team, passing patient to the post-take team, which is getting another consultant to take over the care of that patient. Usually in the handover, there's a patient list, and you tend to have a sort of take ward round, which may merge with the regular ward round. So I hope this helps. Now, the other thing to be clear about when it comes to ward rounds is hierarchy. So read the room and read the demeanor of the person leading the rounds, and you can also see how you best integrate. So that's a really useful social skill to have. Now, with that done, let's back up a little bit. Now, when you are preparing for ward rounds, it's something important that you should do. If you have access, do some personal preparation. So if you can have the list beforehand, do some personal preparation. Have a bit of review of the list so you have an idea of what you're expecting, and you are able to deliver your own particular role as part of the rounds. Now, with that said, let's move on to during the rounds and a bit after the round. So let's start with during the rounds. It's important to understand that you have a list of patients. So if you are the SHO or the registrar or anyone, you may be responsible with taking the consultant or the senior person doing the rounds to the patient's bedside. So it's useful to know where these patients are. Oftentimes you will combine this with your bleep, which means people can bleep you, or you may have a deck and you receive a call. So you have to have a way of continuing to take note of your bleep, and then you may call them, excuse yourself and call them and tell them that I'll call you back, or give me your bleep number, or make an arrangement to, take the whatever it is they want to talk to you about. Understand that there will be stress level during the ward round. So stress levels will go high, especially when you are doing rounds with a new team. And then also styles of communication varies. Some people are very fast, some people are very slow. So it's normal that you would feel a level of stress. Yeah. So do not worry about it. Also understand that you would receive pressure from all angles. You would receive pressures from, your clinical team, external clinical team, the nurses, and things like that. So these are things that you should expect. So you manage, all of these things together. With that said, during the rounds, there's also an important part, which is documentation. It varies from trust to trust. In some trusts, you may be able to prep the notes, meaning you've done halfway documentation. And because these notes are real time, you can edit them as per what has been discussed in the rounds. So you may be able to do your documentation on the go, or you may take your documentation on paper notes and then document later. It all depends on the common practice in your trust and what works for you in particular. Yeah, so while you're doing the rounds, there would be, of course, problem lists. The problem list will be addressed by the clinical firm doing the rounds. That oftentimes leads to job lists. So you should have a job list for all of your patients. usually sensible if you have the jobs against the patient list. Now, with that said, the job list is probably one of the places where you can show that you are a useful member of the ward round, and I'll explain to you. So bloods, patients would require bloods to be done, bloods to be taken, bloods to be chased, and things like that. So it's important for these jobs to get done, especially according to priority. Regardless, try to get as many of them sorted out as possible. Look for shortcuts, look for reasonable shortcuts to use. You would also have imaging, so x-rays, CT scans, things like that. Again, requested, chase up, and escalate. You would have discharge summaries in some places, electronic discharge summaries. Also, look for shorthands, easy way to deal with this. You would have a lot of pressure from bed managers, hospital managers, the nurses to complete this so that patients can be discharged from the hospitals. TTOs usually goes with discharge summaries. So TTOs are medicines take after or take out or take away. To take out, to take after, or to take away. So therefore, prescriptions. So you need to fill in the prescription, look at the trust guidelines, and do the right thing. Yeah. So don't forget the essentials for a prescription: right patient, right dose, right route, and right duration and things like that. Referrals are also a big part of what you would find during the ward rounds. So referrals to other teams, especially, and then here sometimes expect that you may have some tensions, but remember the handover, the SBA. Try and understand the reason why you want to discuss a patient with another specialty. Have a question in mind, give them relevant background, answer their question politely, and understand that until the other team has accepted to your referral, the patient is under your care. So here is where there may be tensions within teams. If something, again, is beyond your expertise, do let your seniors know. Prescriptions I've said already. And then I've talked about pressure. So this is probably the key things when it comes to the ward round. So remember handover, remember understanding the hierarchy, remember your personal preparation before the ward rounds, remember during and after the rounds, bleep, decks, pressure and stress that comes with it. Also remember documentation, problem list, job list, and the jobs to be completed. And then at the end of the day, try and have a summary and recap and try and see what you've missed and keep getting better. What you do. My name is Jonathan Aja. I am from Large Academy. I hope you found this content useful.